Nelson and members of the board. Departmental item number 4 is from the County Executive Office. It is a hearing to consider recommendations regarding an update on the coronavirus disease 2019, COVID-19.
Good afternoon, Chair Nelson and members of the board. I apologize, but I believe that there's some landscape work that's being done, so I hope you can hear me. My briefing this afternoon, includes an update on our rates as well as an update about our indoor masking health officer order. Madam Clerk, may I have my slides? Next. So as of November 8, we have 45 new cases, which is a 17% decrease from a 2-week average of 54. Our active cases stand at 336. We reported one death yesterday of an individual who was 70 plus years of age from Goleta with no underlying medical conditions. We currently have 35 individuals hospitalized with COVID-19, and of that, 8 are in the ICU. Santa Barbara County has a total of 44,596 cases. We've lost 527 community members to COVID-19. Our current case rate is 9, and testing positivity is 2.9. Next. This graph describes our daily case rate per 100,000. The gray line describes the rate with a 4-day lag and is updated Monday through Friday. And as you recall, we began calculating this rate with a 4-day lag instead of a 7-day lag like the state. We did this early in the summer as we needed to see the trends quicker as cases were increasing rapidly. The blue line describes the California adjusted case rate, which is a case rate with a 7-day lag that the state adjusts based on testing volume and is reported each Tuesday. So if we look at a period from, say, October 21st through November 4th, we can see that our case rate has decreased roughly around 22%. Next. This graph describes our case rate by vaccination status. As of October 28, our case rate among unvaccinated individuals is 18.3 per 100,000 versus the low 3.3 per 100,000 among vaccinated individuals. This means that in Santa Barbara County, people who are unvaccinated are 5.5 times more likely to get COVID-19 than fully vaccinated people. Another takeaway from this graph is that during the 2 weeks time frame from October 14th through October 28th, we can see that the case rate countywide decreased by 5%. But if we drill down, we see that case rate among the unvaccinated increased by 6%, whereas the case rate among vaccinated decreased by 31%. The data in this graph shows a very compelling case how vaccination is helping the decrease of transmission in our county. Next. Currently, we have 60.2 of hospital beds in use. This means that 363 out of 603 beds are occupied, with 35 of them for COVID-19 patients. And with regards to staff adult ICU beds, we have 63.2% in use. What this means is that 48 out of the 76 beds are occupied, with 8 of them being for COVID-19 patients. This is critical. It is very critical to safeguard our hospital capacity, especially now during the winter months, given that historically we will see an increase in hospitalizations due to respiratory illnesses. We do worry when we see an uptick in cases because invariably we can anticipate an increase in hospitalization within 2 or 3 weeks. As I showed earlier, case rate among the unvaccinated is unacceptably high at 18.3 per 100,000. Again, this is why vaccination is so important, because vaccines are effectively preventing severe illness requiring hospitalization. Next. Our hospitalization rates have made very minor decreases in the past 2 months. In the past 2 weeks, we've only seen a decrease of roughly 5%. Although our ICU numbers have fluctuated and we are seeing a current decrease of 38%. In addition to this graph, I'd like to share with you that from May to October, we had a total of 611 hospitalization. Of this, 81% were unvaccinated. And if we only look at October, we had 113 hospitalizations. 82 were unvaccinated, meaning 73% of our hospitalizations in October were unvaccinated. Next. This graph shows our vaccination status. So when we look at the eligible population, we have roughly 72% of our eligible population as fully vaccinated. And this number reflects the 12 and above. I would like to point out that tomorrow we will be adding the 5 to 11-year-olds, so roughly about 41,638 into the eligible group calculation. So just a heads up, this means that our percent of eligible fully vaccinated will decrease to around 64.8%, of course, because the denominator will be increasing. In total, we have roughly 60.7% of our total Santa Barbara County population as fully vaccinated. Next. This chart shows by zip codes the percentage of vaccine coverage. We have made strides increasing vaccination rates in low health equity metric communities, as you can see from this chart. We have still, though, a wide gap in vaccination rates. We have 4 communities where vaccination rate is below 64%, and those are marked by the first 4 in red. We also have 4 communities with less than our county rate of 71.8% among eligible individuals, and those are characterized by the orange. The light yellow all the way to green are communities where vaccine coverage has exceeded what we're seeing as an average in our county. Next. So our work continues. We know that mobile vaccination programs work. In our community, we will continue to offer clinics throughout the county in partnership with community partners. Our November calendar is available at publichealthsbc.org. Last week, we were at Santa Barbara High School. We were at the Boys and Girls Club in Santa Maria, as well as at the CARP Children's Project. We also have several pediatric clinics planned. Our first clinic was yesterday in Guadalupe, and by all accounts, it was wildly successful. We offered a total of 148 doses, with 89 of them to the newly eligible group. So that's 60% of our vaccine clinic yesterday went to the 5 and 11-year-olds. Next. Currently, we are managing 28 active outbreaks, 2 among businesses, 21 among schools, and 5 among congregate living facilities. Next. I'd like to update your board on the Santa Barbara County indoor masking health officer order. As you recall, the indoor masking mandate was issued on August the 6th. As our daily cases were rapidly increasing. At that time, as we also saw COVID-19 hospitalization increasing after a period of stabilization. And we also witness vaccination rates plateauing. We put that in to knowing that the significantly more transmissible Delta variant had become the predominant strain in the US as well as in Santa Barbara County. So to control the spread of COVID-19, we issued a health officer order for all individuals in the county of Santa Barbara, whether vaccinated or unvaccinated, to wear a face covering at all times in indoor public settings. With limited exemptions, and recommend that businesses make face covering available to all individuals entering business. Our current status. Our daily case rate is decreasing, but we are also seeing minor surges happening in other locations as well as throughout our state. Our hospital capacity is unstable and especially worrisome given the winter holidays and the winter season approaching. And our vaccination rates are slowly inching upwards, even though we also, as I just shared, see that in some communities it is below average. Next. So our Santa Barbara County Health Officer order for indoors masking was renewed, and it will be in effect until December 4th. As we shared before, the Santa Barbara County Health Officer order will be lifted when case rate is less than 6 per 100,000 for 2 weeks. So what that means is when we are seeing less than 27 cases a day. If Santa Barbara County Health Officer order for indoor masking is lifted, there will be triggers that may cause a reissuance of the order, such as high case rates, such as circulating variants, and tanking hospital capacity. But even if we lift our local health officer order, masks would still be required in certain settings per state health officer order or per Cal OSHA mandates. And that means masks would still be required in schools, in places of employment, and such as hospitals and congregate facilities, and in all indoor settings for unvaccinated individuals. However, I'd like to share with your board that we are reviewing this criteria that I mentioned, the 6 per 100,000 for 2 weeks with other jurisdictions. Next. We are looking at what other jurisdictions are doing. And so I'd like to share with your board a high overview of what's going around the state. So in Alameda, Contra Costa, Marin, Napa, San Francisco, San Mateo, Santa Clara, Sonoma, and Berkeley, they did issue a criteria on October 7th, and they will lift their indoor masking order when they have case rate less than 7 and testing positivity less than 8 for 3 continuous weeks. And this is they're using the CDC guidelines. The Bay Area counties will also look at the hospitalization and to ensure that hospital capacity is great and hospitalizations is low and stable. The Bay Area will also consider lifting when they have achieved 80% of total population as fully vaccinated, or when it has been 8 weeks after the emergency use authorization for the 5 to 11-year-olds have passed. More locally, Ventura issued their criteria on October 18th, and they have very similar criteria as the Bay Area, and that would be a case rate of less than 7 per 100,000, with testing positivity less than 8 for 3 continuous weeks. With regards to hospitalization, Ventura will lift the indoor masking order when the health officer's judgment of hospitalization as low and stable. And with regards to vaccination requirement, Ventura will consider it when 80% of total eligible population as fully vaccinated, or 8 weeks after the EUA for the 5 to 11-year-olds. San Luis Obispo County is a little bit more simple. In their criteria, they issued it on October 20th, and it is a case rate of less than 7 for 10 days. And with regards to hospitalization, it is low and stable as per judgment of the health officer. When we look further down south, we see that Los Angeles has the most nuanced set of criteria, and that was issued on November 2nd. So LA will lift their indoor masking order when the case rate is less than 7, testing positivity is less than 8 for 3 continuous weeks, when hospitalization is fewer than 600 for 3 straight weeks, when 80% of residents 12 and above are fully vaccinated. Additionally, when there is no significant reports of circulating variants of concern that could threaten the vaccine efficacy. So we are in conversations with our closest neighbors, Ventura and SLO, and looking at a regional approach. I'd like to next. I'd like to share with your board, as there have been inquiries about the difference between the old retired California tier system versus the new CDC tiers. And so with the, as you can recall, the upper half, the old California tier system, the new cases per 100,000 per day with a 7-day average and 7-day lag. Minimal is less than 2, moderate is from 2 to 5.9, and substantial is from 6 to 10, and widespread would be the purple zone with anything larger than 10. With regards to when you compare it with the new CDC case, it is, so CDC is a little bit different. And the main difference is that the CDC tier is based on total new cases per 100,000 in the past 7 days. So it is not daily. So what you would have to do is multiply the case rate from the California system by 7. So new cases per 100,000 in the past 7 days, according to CDC, 0 to 9 would be considered low, and 10 to 49 would be considered moderate, and substantial community transmission is when you have case rate of 50 to 99 for that 7 days, and high would be greater than 100. So if we look at the old California tier, they're basically, and you multiply it by 7, it's roughly very similar. So looking at the old California tier, multiply it by 7, and you would have a minimal case rate of less than 14. The moderate would be 14 to about 41. Substantial would be 42 to 70, and widespread would be around 70. So earlier I shared with your board that our current case rate in Santa Barbara is 9 per 100,000. It would have us in the red tier, substantial transmission, if we use the retired California tiered system. However, if we use the CDC tier, we would then take the case rate of 9, multiply that by 7 to get the number 56, which would land us in the substantial tier as well. And per CDC guidance, if a county has high or substantial community transmission, everyone should wear a mask in public indoor settings. Next. In summary, with regards to lifting the indoors masking health officer order, we will be in conversations with our colleagues in SLO as well as in Ventura. And we will also look at using a case rate, using the CDC tier system, as I just explained. We will also consider hospitalization and hospital capacity like other jurisdictions. We will also be looking at vaccination rates and consider other criteria such as variance and a regional approach. And that ends my presentation, and I am happy to answer your questions.
Okay, questions from the board? Supervisor Levanino.
Thank you, Mr. Chair. Thank you very much, Dr. Reynoso. I think I was kind of the one asking for this to be brought back, so I appreciate that. I have a couple of questions, just going around to different websites and stuff. I was curious, like on the CDC website, how do they get our information? Do we pass it along to them, or do they just extrapolate things that we get that they take from our website? How does that work?
Supervisor Levanino, through the chair, the CDPH feeds the information to CDC. So that's why there's always a lag in their calculation versus our own local calculations.
Okay, because on their website, it shows, and I don't know if this is accurate, but it shows 99% of people over 65 years old in Santa Barbara County have had at least one dose, and 86.5% are fully vaccinated. I don't know if we agree with those numbers. And then it shows 84% over 18 years old, one dose, and 74.1% fully vaccinated. So I hope those are correct, because they are. That's very encouraging.
Yes, so I'm not sure how CDC calculates their vaccination rates. I do know that CDPH is the source of information, but again, our EPI team extracts the data using codes that CDPH has shared with our EPI team to generate what the information that you see on our website with regards to vaccination rates, and in particular with vaccination rates among different age groups and different ethnic groups.
Okay. I wanted to also ask you about a couple of different things. One is booster information. I just got a text from CDPH telling me that I may qualify for a booster, and I know people are asking me, what are the qualifications? How do you qualify for a booster at this point?
So right now, boosters are eligible for anyone who is over 18 and in a job that would increase their exposure to COVID-19, as well as for age 65, anyone over age 65. So how a person would acquire a booster vaccination is to go to myturn.com, and they will walk you through the different criteria. Do you have a medical condition? Are you in a job that exposes? Are you over 65, and you simply check the box, and then it would generate an appointment for you. I can speak to this because I've gone through it just to test it out. And there is no attestation when you show up at the pharmacy if that's where you choose to get a vaccine.
Okay. And then this one might be more of a intellectual, I don't know. I guess the question for me is then when I look at all of our numbers and how well things are going, when, and I don't know what the proper term is, endemic, when does a pandemic end and an endemic begin? Like, when do we say, and I started thinking about, I'm like, I have this contractor at my house and he is a perfectionist and will never leave until I say, okay. I mean, there's always something to be done, but at some point we say, okay, hospitalizations are down, death is down. And I know case rate, we always talk about case rate, but for me, I've always had this thing that cases are not created equally. Like a 85-year-old with a chronic heart condition is different than a 16-year-old that is very healthy. So I know you're coming up and trying to come up with these new outlines, but are you looking on the horizon and saying, yes, what's going to hit when you say this is just something we're going to live with for the rest of our lives and we can't eradicate sickness?
We are in conversation both locally. Dr. Ansorg and I and our colleagues have been in conversation for exactly that same question. When do we consider routinizing our response efforts, and when do we do X, Y, and Z, and accepting that COVID is part of our new norm, and when do we remove it from the pandemic state to the endemic state? With regards to when do we move from a pandemic to an endemic state, I think that's is a conversation that happens at the state level with CDPH, and that is also a conversation that's happening on a weekly basis. Unfortunately, Santa Barbara may be in a better state, but a lot of our colleagues throughout our state are not seeing a low case rate or a trending downward case rate as we are seeing. So I think that it's a conversation that happens locally as well as regionally. We are in conversation with SLO and Ventura and talking about community spread, talking about vaccination rate, and talking about case rate, because I think that whatever happens around the corner will be better anticipated as a region. And we're seeing an uptick in cases in LA. So that has us worried because we know that invariably that we will see some effects of that in the coming weeks.
Just two other things. One is I think it's important for the public to understand what you had also put in your presentation is that regardless of what you do, masks will still be required at schools and at work and indoor locations for unvaccinated, regardless of what your proclamation is. This is a state controlled mandate.
Right, that is absolutely correct. The state has a very detailed list of where masking is required, and us lifting our local health officer order will not impact the state orders and the state Cal OSHA mandates.
And then I didn't know if Dr. Ansorg, or maybe you could answer this. I don't know if he's on the line, but I was just curious about, there's new treatments out. Pfizer's talking about a pill. I know England's rolling out the Merck pill this month and also Pfizer. And how do you see that rolling out in Santa Barbara County?
So we are really excited about the prospect of antivirals being approved because ultimately it will prevent lives lost. It can prevent severe illness and poor outcomes. So we are excited about that prospect. And that is one more tool that we will have in our fight against COVID. And that is also a specter of when perhaps we can consider COVID-19 as endemic.
Thank you. Thank you, Supervisor Lavanino. Supervisor Hartman.
Well, that was my key question, was the new drug and how that's a game changer. But in terms of hospitalization, what would you consider a low and stable rate in Santa Barbara County? That's one question. And then if we look at the other counties, it's vaccination rates or 8 weeks after the emergency use authorization for the 5 to 12-year-olds. So could you elaborate how you're thinking about that, how our public health department is thinking about both of those questions?
Sure. Supervisor Hartman through the chair. When we look at hospitalization and hospital capacity, that's a conversation that we will need to engage our hospitals leadership in what is the percentage. Right now, we're saying that we are in the danger zone when we have less than 35% hospital beds available. That is still, and we're seeing somewhat of an unstable fluctuation between our hospital bed usage. So it's a conversation that we're planning to have with our hospital leadership. With regards to IC staffed adult ICU beds, we worry when that capacity falls below 20%. The state sees it as problematic and crisis if it is less than 10%. So again, I would need to have that conversation with and engage the hospital partners in do we keep the 35%? Do we go down to even a greater 45%? So that is a conversation to be had. And that's why I was not able to bring a decision before your board today. With regard, I'm sorry, I forgot the other part of the question.
Vaccination rates, some of the other counties, they say 80% or 8 weeks after the emergency use authorization for the older children.
Right. So when we issued our masking order, and we shared with your board in October that we would consider lifting it when we had a case rate of 6 per 100,000. At that time, we and we still do believe that when our vaccination rate is at a certain level, 80% or higher, we will see an inverse effect on case rates. So we know that jurisdictions like Marin that have a high vaccination coverage rate also have an extremely low case rate. And we are in discussion with SLO and Ventura on their criteria, specifically whether they will maintain the 80% of total eligible population to include the 5 to 11 and what is the impact of that. So those are the moving pieces. When these jurisdictions issue their criteria of 80% of total population fully vaccinated or 80% of total eligible population, the 5 to 11-year-olds had not been approved. And so with the 8 weeks would take them into pass through the winter season and into perhaps January.
All right, thank you. I've got a few questions. Let's go to slide 14 here for a moment.
Okay. That's the other way.
Yeah, the CDC, the tiers. So that has Santa Barbara County in the moderate CDC tier, is that right?
No, it's the orange.
Okay.
It has us in the substantial.
Okay. Well, this morning I had it as in the moderate, and in your chart it has it in moderate. So I think that's where there's some confusion. So,
Okay.
and then if it was in the moderate, the CDC would recommend not having a mask mandate. Is that correct?
So that would be over a period of time, but yes. So if a county is in the low or moderate, then then they would not need to have the indoor masking. But so from what I showed in the previous slide, typically the other jurisdictions are looking at the case rate over a 3-week period to allow for stabilization of the case rate.
Yeah.
So
And
it wouldn't be on a daily basis.
And then we actually have in the blue, according to CDC, on the percentage of PCR tests positive in the past 7 days, right? We would be in the low category.
Yes.
Because, that's something that I think is something that we should be thinking about as we approach this, is that, we have been in a low, and we have been in a low for quite some time. One of the reasons why I think our rate is higher than other places throughout the country and throughout the state potentially is because we actually test a lot, right? I mean, we test at a significant level in Santa Barbara County in comparison to other places, especially in the country. Is that right?
I think I would say that so when you look at our adjusted case rate from CDPH, the adjustment has already been calculated. Our volume of testing or lack of testing.
Okay. Well, again, I think as Supervisor Lavanino made the point about as we move towards being the endemic, and that COVID is probably going to be with us, for an extended period of time, as and the great news is we've been adapting, and there's new treatments available that would help people continue to protect themselves. I think. Well, here's the other question. We're seeing throughout the country, other parts of the country like Florida, where they don't have a mask mandate or requirement, actually be considerably lower than California. Any thoughts on that?
With regards to the case rate,
Yes.
it came at a great cost. So you would have to look at the number of hospitalization and the number of deaths, and calculate that by per capita to really measure apples to apples. And but we, at this point in time, I do believe that we have an increasing case rate, and the experts are flummoxed, and we are wondering why that is. So there's several thoughts circulating.
And the current 6 cases per 100,000, do you know any place else in the state or country that has a stricter standard?
No, I don't. So
Okay.
Santa Barbara, again, Santa Barbara is considering moving to mirror other jurisdictions like the Bay Area, but that would be a 7 case rate per 100,000 for 3 weeks versus the 6 per 100,000 for 2 weeks.
And that would be in conformity with the CDC guidelines.
Correct. So we are, that is we're giving serious consideration to mirror the CDC guidelines.
I think it's a great idea. Thank you. I have a couple questions for HR, but I think while you're with us, Supervisor Williams, do you have a question for Dr. Del Reynoso?
Well, sort of like a question for Dr. Del Reynoso, but also for us. I mean, isn't the Ventura and Bay Area criteria is more stringent in that it also requires 80% of the population to be vaccinated too? I mean, in trying to answer your question, yeah, it seems like there's a lot of places with a more strict standard because of the 3 weeks and because of the vaccination requirement too. Now, maybe maybe as a society, it's better to have the vaccination requirement because that's something that we can all do something about, right? If we want to get out from the mask mandate, we can make sure we all go get vaccinated, right? So I think there's certain logic to that, even if it was a less restrictive case rate. But
Thank you. All right. Any other questions for Dr. Del Reynoso? Okay, I've got a couple quick questions for HR. I understand understand Maria Elena is available.
Yes, I'm right here.
So my office is getting a lot of questions about the testing procedures that we're having for our employees that have chosen not to get vaccinated. One of them was on the religious exemption. Previously, they were able to just check a box that they were on a religious exemption. Now they have to provide some written comment as well. Can you set
Yes.
the standard for that?
Yes, I have Yvonne Torres, who's the lead on the testing program for the county. So Yvonne, do you want to respond?
Of course. Good afternoon, Chair Nelson and members of the board. So yes, we are requiring, there's a process for the religious exemptions. The employee would fill out a declination form stating that they do have a religious belief, and then they are to attach a statement that is reviewed and considered through guidance from county councils, and the request will be honored once that attachment is attached to the declination.
So are we evaluating, will we reject somebody's religious statement?
We will not reject a religious statement. They're case by case, as long as it's a reasonable request. And we have actually had 66 already submitted, and we have not rejected any of those.
Right, thank you.
Mhm.
And then the other question about the testing is, I understand there's some concerns that to do the testing procedures requires our employees to disclose their age, their race, and their sexual orientation. Is that correct?
That is correct, and that is required by state law for the testing results. And this is for the information to be sent to the CDPH. And it's a requirement pursuant to the California Code of Regulations. And the information that they do give is protected by HIPAA, and the company that we're contracted with does protect personal health information.
I don't think that's what we should be doing as a county, making our employees disclose that information. I think it's problematic. I'm fine with a testing option. You know, I just understand that's something that we've agreed to do, but I think, you know, there's a certain amount of invasion of privacy that I think we've ventured into here that I think is a concern. I think should be relooked at for those of our employees do not feel comfortable sharing some of those more intimate details of their life.
Right, and I could defer that to Vaughn as to the requirement and why that's required by the California Code of Regulations if she's still on. Vaughn?
I'm sorry, can you repeat that?
Sure. Why is it that the state is requiring employees to answer or anyone to answer those questions, the demographic information?
It is just, it's depersonalized, and it's for calculations. So when we look at, I know that your board has asked in previous meetings, who's getting tested? Are they symptomatic? And so the tester is asked demographics so that we can track and see trends and support that information if needed. So it's something that we ask from our community members from day one when they test at a state or public health sponsored, their age, their occupation, a whole slew of demographics. And again, it is really just for data gathering and analyzing so that we can see and spot trends.
Mr. Chair, this has
Williams.
been a big discussion in state law, especially around public health matters for a long time, for decades. And in recent years in the legislature and in state government, the discussion has been that you really, if you can't disaggregate data, you cannot identify populations that are getting disproportionate effects on them, whether that is racial groups, economic groups, and I suppose this is part of it, or sexual orientation. So this pendulum has swung sort of in favor of getting disaggregated data. In order to get disaggregated data, you actually have to ask people. I think probably most of these things are not rejected if they don't answer it.
They are.
But that's the issue at stake.
No, and I'm fine with that as being asked, but when you're not allowed to test without giving that information, I think that's problem. So, and that's my understanding. If that's correct, HR, is that?
So
Torres?
Chair Nelson and members of the board, so the sexual orientation question can be bypassed, but not the gender. There are some questions in the questionnaire. There are some questions that the employees can skip, but there are certain questions like the name and date of birth and gender that you can't skip. So there are questions they can bypass.
Okay, well, that's different than the information I understand. So if that's the case, then I feel better about that. But that was what's concerned that I've heard from our employees, and understand that you and your own staff has truthed that out, and that you have to do that. So I think it's really important that we find out one way or the other. And if we do require that to be disclosed, I think we should look at alternative solutions for our employees that aren't comfortable sharing that information publicly.
Understood. Thank you.
All right, so I believe we have some public comment.
Yes, Chair Nelson.